The thought of operating on their little boy's brain terrified Will and Jennifer, but Dr. Steinberg had a special weapon to help fight for Cash. Some say it's a miracle of modern medicine, called surgical theater.
Surgical theater is a type of three-dimensional virtual reality that, in my view, has revolutionized the way we can approach surgery, plan surgery, educate patients, and engage patients. Now look at the
Surgical theater gave Dr. Steinberg a fascinating and detailed look into Cash's head before he would ever lift a scalpel.
The way it's done is to take the radiologic imaging, and that can be an MR scan or MR angiogram, a CT scan. We can create a three-dimensional visualization and have a 360-degree visualization or version of what we're seeing. And what's unique is that this represents that patient's individual anatomy or pathology. It's not a generic model, and so it has a huge advantage for planning the surgery. We can actually rehearse the surgery, and it makes it much safer and easier for the surgeon and the patient. So using surgical theater 3D virtual reality, I was able to more precisely analyze Cash's vasculature and determine where he needed the new blood vessels, determine whether there were any special problems that I was going to encounter that I would not have been able to really appreciate on the conventional imaging.
After several rehearsals with surgical theater, Dr. Steinberg was ready, and the little boy who's taught us all the true meaning of courage arrived smiling.
Well, this is what we're doing.
As his dad carried him down the hall of the hospital at Stanford.
Cash is the bravest kid I know.
Yeah, despite his genetics. We want Dr. Steinberg to show you what we saw in the goggles. So bring them on out, the virtual reality goggles.
Help you put them on. And this is actually the first time that you're going to be seeing this. Yeah, this is incredible.
Yeah. So this is so.
Okay.
Oh, this is incredible.
This is your baby boy.
Take us through, Dr. Steinberg, what you guys are seeing right now.
So Jennifer, you can see Cash's brain. This is after surgery.
Okay.
And here's the vessel that I used. This is the scalp vessel that I chose.
Okay.
And this is what's supplying new blood to his brain on the left side. And I'm going to take you into his brain. We're going to zoom right through this hole that I left.
Oh my gosh. Oh wow.
And now we are inside his skull and brain.
Oh my God.
And if you look to the left, you can see the front. If you look,
I'm literally, okay, sorry.
Look to the right, and you can see all the new vessels. Many of these have grown in from the vessels we placed on the surface of the brain. They sprouted new blood vessels to supply his brain and prevent further strokes.
Yes.
And if you look deep here, you can see on the other side, that's the right side of his brain, there's the scalp artery that comes through the hole, laying on the surface, and here are some of the vessels that grew in from that scalp artery.
Amazing.
So if you recall, before surgery, he had very few vessels in his brain because of the moya moya, and now he's got a large number of them with excellent revascularization and blood supply.
That's so amazing.
And thank you for sharing your story. This is really, truly amazing. So.
Thank you.